Welcome to how to create a flare plan in under 60 minutes. Well, okay, so that's going to be our goal, is to keep this to under 60 minutes. But I promise you, when you actually get to the flare plan part of actual creating it, you will be well informed with lots of tools by the time you're done this program. So I'm thrilled. I'm Cindy Messerly. I'm the CEO of the Philadelphia Tri-State Chapter of the Lupus Foundation of America. Our chapter serves Eastern and Central Pennsylvania, Southern New Jersey.
Cindy, lean into your mic. You just went a little hollow again.
Okay.
That's better, yeah.
Hold on, maybe what I'll do, and just make it simple, I'll pop some headphones on and let me just see if that helps at all. Is that better for everybody? Is that improved?
No, that actually is not better, Cindy.
We'll just talk. That's all right. We'll talk. I'll just make sure that I'm loud, and I will talk closer. So, okay. As I mentioned, we service the Eastern Pennsylvania, South Jersey, Central PA, and Delaware service areas. So welcome, as you've heard, people from all over the country, and we're thrilled to have you here. Just a few housekeeping notes. As I mentioned, this is a webinar, so your video camera won't work, so don't think that it's your technology not working. And but please utilize the chat feature, and any questions that you have, Maggie from our team will be monitoring the chat, and we'll make sure that any of your questions get addressed. We are recording tonight's webinar, so you'll have it for a future reference. So if you have to leave us a little bit early and maybe don't catch the last little bit, or technology issues, whatever, we will be recording and you'll be good to go and you'll get a copy. We'll have this posted on your local chapter's website. And also, if you have any additional questions following this program, please feel free to reach out to us at info at lupustristate.org, or reach out to your local chapter. They'll be able to guide you and assist you as well. So as many of you know, and this bears no repeating, Maggie, you can go to the next slide. Give her a minute to catch up. There we go. I just always like to share and remind everybody with our vision and mission as the Lupus Foundation of America. With multiple chapters and regions across the country, we do share a common mission with a vision of life free of lupus. And our mission is dedicated to improving the quality of life for all those affected by lupus. We do that through programs just like tonight: education, research, support, and advocacy. And tonight you're getting support and advocacy, or I'm sorry, support and education are two focus points of tonight's program. So without further ado, let's go ahead and get started. I'm thrilled to introduce our presenters for tonight's program. Did I go out again?
No, that picture's like 10 years old. I love it.
So say, hey, young is better, right? We love.
There you go.
So Dr. Belinda Birnbaum is a fabulous partner and friend of our chapter. She has done numerous programs for us. She is currently practicing at Birnbaum Medical Specialist in the rheumatology department here in Pennsylvania. She graduated from the University of Rochester School of Medicine and Dentistry and has been in practice for nearly 20 years. Dr. Birnbaum also specializes in internal medicine and has been a terrific friend of the Tri-State Chapter. So welcome, Dr. Birnbaum. And our second presenter tonight is Ms. Cheri Perron. Cheri has been living with lupus for 26 years and has been an active member of the Philadelphia Tri-State Chapter for almost as many years. We just love our Cheri. And currently, Cheri serves on the National LFA Board of Directors and is a former board chair and longtime board member of the Philadelphia Chapter. And she has served on the board for, oh gosh, Cheri, more than 10 years?
Absolutely, yes.
And collective years along the way. She is also an SLE self-help course facilitator for our chapter, a peer counselor, an invaluable volunteer, and all around, she's just a go-to person in our chapter. So welcome, Cheri, and thank you for being here tonight. On tonight's agenda, Dr. Birnbaum will present the FLAIR 101, really helping us understand what a flare is all about and how to identify it. And then Cheri will be presenting the details on how to really define your flare plan and create one so that you'll be better prepared if and when a flare happens. So thank you both for being with us tonight. So Dr. Birnbaum, I'm going to turn it over to you.
Thank you. Thanks for having me. I think Maggie has my slides and
Yep.
we'll somehow magically make them appear. There they are. So again, thank you to the Lupus Foundation. You know I love doing any program with you guys. For those of us in the tri-state area, I feel really lucky that we have Cindy and Maggie, who's behind the scenes running the show. So we're going to talk tonight about this webinar is entitled Lupus Flare Plan, but really what it is how to manage uncertainty with lupus. It's a disease that we know isn't necessarily predictable. And so planning ahead is always going to help someone feel more in control of their disease. And so as much as people try to do everything they can, always having a plan makes people feel better. Next slide. Okay, so we're not going to cover everything lupus is tonight because that's not what this is about. But I really think that if you're going to understand what it is for your disease to act up, you need to understand what the symptoms are. I think some people here might be new to their diagnosis of lupus. When you're diagnosed with lupus, there are antibodies that your body is making, and rather than attacking something foreign, it's attacking your organs or your blood cells. And so with that comes certain blood tests. And so in order to have a diagnosis of lupus, you need to have an anti-nuclear antibody. Without the anti-nuclear antibody, you do not have lupus. But there's other antibody tests and immunology tests that do go along with that. And what I encourage my patients to do is to really understand what antibodies they have and what levels they have. Maggie, when I look at my slides, they're blocked by pictures of me, you, and Cindy. Is there a way to get that? Well, I think I kind of know.
Yeah.
Okay.
How's this?
Don't worry about
Good?
it. I got it. I
Okay.
got it. When we talk about lupus now, it used to be the criteria and the diagnosis for lupus change every few years, how we classify a patient with lupus. But now what you need to have are these immunologic criteria, which are the first two things, is anti-nuclear antibody and these other antibodies and immunology tests. And then you need to have certain clinical domains, which could be fevers. We know that lupus patients get fevers. Certain features in your blood cells, be it a low white blood cell count, low platelets, or an anemia. Lupus can affect the brain, causing seizures, psychosis, or delirium. It can also affect what we call your mucocutaneous manifestations. So those are like the parts that you can see visibly, your skin, your hair, sores in your mouth. Lupus can affect the serosa, and serosa is a fancy word for the lining of your heart or lungs and cause something called serositis or pleuritis. If it involves the lung, the pleura, or a pericarditis, cardium is heart, your joints and your kidneys. Next slide. And this is just a fancy slide. When we're classifying patients as lupus and we're looking to score them in terms of how serious their disease is, we assign a certain number of points based on what symptoms you have. And so kidney disease and brain disease is going to score higher than, say, joint disease or sores in your mouth or skin disease. And so this is just a fancy scheme of what your doctors are doing and calculating when they're trying to classify your lupus. Next slide. All right, so what I want everyone to walk away with tonight is that getting sick with lupus is not always your lupus flare, and that takes teasing out. And so anytime we see a patient with lupus who's ill, we really have to figure out, is this the lupus? Is it an infection? Is it a problem with one of the medications that's used for their lupus? And if you're having chest pain, is this part of lupus or is this heart disease that we know can increase in frequency and severity in patients who have lupus? So those are always the questions that I ask when I'm called to see a patient who's sick. I don't automatically assume that it's lupus. Cheri and I talk about this a lot. I've talked about this a lot with my other patients. Once you walk in the door and say you have lupus, the thing we don't always want to assume that that's the only thing that's going on. We need to take a step back and have a broad view of what could be going on. All right, next slide. All right, So again, when we talk about flare and things acting up, there's different levels of flare. A mild flare, if your joints are hurting a little bit, if you went out in the sun for too long without sunscreen and now you have rash, if you're getting sores in your mouth, versus more severe signs and symptoms of flare, swelling in the legs that would indicate possibly kidney dysfunction, or sometimes heart not functioning properly, fevers, chest pain, and then sometimes new headaches. Now, a headache is not always a lupus flare. There are many reasons to have a headache. Sometimes if your blood pressure is high because of your kidneys, you'll have a headache. Sometimes the medications are going to give you headaches. Sometimes feeling sick will give you a headache. But it's actually pretty rare that the headache itself is an actual manifestation of brain disease from the lupus. All right, next slide. All right, and so again, a flare is not always an emergency. Now, obviously, if you're having trouble breathing, chest pain, all of a sudden you can't walk, see, move, that's an indication to go to the emergency room. But what I try to work with my patients to do is to kind of call first and try to figure out what's going on. I always it's always so hard when I see a patient in follow-up and I say, how have you been the past 2 months? And they say, well, I was in the hospital for chest pain. And I say, oh, why didn't you call me? We could have figured that out and done this, or we could have done that and saved you an ER visit. So I do try to have patients call their rheumatologist first, knowing that it's sometimes hard to get your doctor on the phone. But if you do wind up in the emergency room, you can lead with your diagnosis, but also your symptoms. You're your strongest advocate. So if you are in the emergency room, the advice I'll leave you with tonight is always ask that the ER speak with a rheumatologist that's on staff at the hospital, or call your rheumatologist. You're in the emergency room already. If they're admitting you, we can always figure out what's going on. But if you're feeling sick and they don't think you're sick enough to go home, and then we get a call the next day and we look and we see that blood work was done, but maybe there was some blood test that we could have used to help us figure out what's going on that they could have easily added on, or maybe there was another study that they could have done, or something they didn't think about. So what I ask my patients to do is, if you are in the emergency room, always advocate for yourself and ask that they contact the rheumatologist, okay? Always know your medications, your doses, and any recent changes in your doses, especially with steroids. If you just went from 30 milligrams last week and all of a sudden, for some reason, you're on 10 due to a miscommunication, or you ran out, be honest. If you're supposed to be on CellCept 6 pills a day and you've only been taking 2, and the doctor looks at you and says, so you're on CellCept 6 pills a day, you feel kind of bad saying, no, I'm really only taking 2 when I forget my evening dose. Be totally honest. No one gets mad. What gets hard is when we go in and we have to try to figure out what's going on with this patient, and it's their lupus because they're not taking their medications. And that doesn't mean you're a bad patient or you're a non-compliant patient. It means it's hard to be a lupus patient, and it's hard to remember to take your medications, and it's frustrating to have to take medications. And so as long as you're honest, that will be the most helpful thing to do. Next slide. Oh, I'm done. All right, so that was, I'm done talking. I wanted to get through this quickly so we could get through it. So I'll say, just in summary, get to know your lupus, get to know what your symptoms are. If you're having symptoms that you're unclear of, before you go to the emergency room, it's always good to check in with your rheumatologist. Symptoms that you're having is something we may be able to figure out over the phone. We may be able to figure out with these days a telemedicine visit or an in-person visit if your offices are doing that, depending on what's going on. So and certainly in an emergency room situation, advocate for yourself, and you always want the rheumatologist to be aware of an emergency room visit, especially if in an emergency room discharge. All right, and now I'll turn it over to Cheri.
All right. Thank you, Dr. Birnbaum. That was
And I
very
think
good
real quick,
information.
I'm taking questions at the end so that we can get through Cheri's presentation. So keep chatting them into Maggie.
Yes, ma'am. So what is a flare plan? A flare plan is actually just that. It is a plan that you put in place to anticipate and deal with the situations and circumstances of life. When you have a lupus flare and you may not be able to do the things that you would normally do, you need to have a plan in place. Who are those people in your bubble, specifically right now during the pandemic, that you can go to say, hey, I need your help? Next slide, Maggie. So, why should you have a flare plan? We know that lupus is something that we cannot control, but stress creates problems for us that are living with lupus. So we can control the things that we can control. So having a flare plan will help you maintain control over what is possible to control. The circumstances in your life and the things that are going on, you may not always be able to control them, but you can certainly have a plan in place to be able to deal with them. Having a flare plan will open the door of communication with others. I know I have found personally over the last 25 years of working with the Lupus Foundation that a lot of us living with lupus, I don't know if we're still in denial, but we don't want to talk about it. So we don't always open that door of communication, telling and sharing our diagnosis with other people until it's a have to. So you want to have a plan to help prevent the added stress and the crisis when a flare does occur. Like what Dr. Birnbaum said a few minutes ago, every flare is not an emergency situation, but when it is an emergency situation, you want to have a plan in place so it minimizes the disruption to your family and in your family. Having a plan will lessen the anxiety and worry and hopefully diffuse some of the fear and uncertainty, because in your family, I know for myself, I will minimize the effects of my symptoms because I don't want other people to worry. But at the same point in time, they need to know what's going on with me, because if I have to go to the hospital, if I have to go to a doctor's appointment or something in a serious situation, everybody needs to be informed and know what their role is in the process. Having a plan promotes coping and provides a sense of security for everybody involved, specifically those members of your family. A plan will provide additional resources to help deal with the increased demands of a flare. And also it reduces the feeling of being alone or out of control in a crisis. This is a small part of what you can control. Next slide, Maggie. So how do you develop a flare plan? You start by thinking about what you do on a daily basis. What is your routine? What do you do at home, at work, if you're still working outside, out of the home, volunteer? And if you can, number those responsibilities in the order of priority if you are handing off a flare plan to someone else. And we'll talk more about that in detail a little later on. But write down the details of each responsibility. Once you put something in writing like that, you may be amazed to see what it is you do on a daily basis. And I would challenge all of us to write out what we do, not necessarily just for a flare plan, but just sit down and think about your day. What do you do during the course of the day? Are you too active? Are you not active enough? But write out the details of each responsibility, especially if you're handing that flare plan off to someone that you want them to step into your place to take care of things that you might not be able to take care of as a result of a lupus flare. Arrange assistance when you can. Now, the last part says revisit yearly. We need to revisit it now. If you have a flare plan, I would strongly suggest you pull it out and look at it now, because the pandemic has changed a lot of things. And the people that you may be relying on during, when you first made your flare plan, you may have to look at that now and say, oh, is that person in my bubble? Is that person in my circle of security right now, or my circle of safety right now? Or do you have to revise your plan? Next slide, Maggie. So the things that you need to consider are, who are your healthcare providers? Meaning, who are your doctors? What are their phone numbers? Do the important people in your life know who your doctors are and their phone numbers? And then you should think about who else needs that information. What medications do you take? A lot of us living with lupus take multiple medications for different reasons. How many medications do you take? How often do you take it? What are the names of those medications? If anything should happen and you're not able to speak for yourself, does someone in your circle of safety know what you're allergic to? Do they know what your allergies are? Where is your insurance information? Because when you go to the hospital, you know the first thing they're going to ask you about is what's your insurance information? So you should always have someone with you or someone that has that information that knows where it is so that they can provide it when it's asked for. Next slide. So the things you need to consider: your family members at home, your family is not at home. If you have pets, excuse me, who's going to take care of your pets? Who's going to walk your pets? Who has an extra key to your house? Who is in that circle of safety that you have given that key to? If you have small children at home or at school and you're not able to pick your children up from school as a result of an emergency or a lupus flare, what is the secret word or something that you have established with your children so they will know that it's safe to go with the person that has come to pick them up? So you not only have to think about yourself, but you have to think about your children, think about your pets. Unfortunately, our bills are not going to pay themselves as much as we would like them to go away, but you have to think about your bills if you should have an extended hospital stay. If you're a plant lover, who's going to take care of your plants? And all of these things may not seem important right now, but when you're laying in that hospital bed and you have an emergency and you're not able to do these things, those are the things that are going to run through your mind that could possibly cause you stress. But if you have a flare plan in place, you will already not have to worry about it. Just implement the flare plan and everybody will know what their role is and what they need to do. The other thing to consider are your neighbors, your close friends, and your peer group. Again, right now, going through this pandemic, are they in your bubble? Are these people that you can go to for help and assistance? And then who can you go, who can help out if you do have a flare? It's not easy as a lupus warrior to ask for help. Sometimes we have that big S on our chest and we think we can do it all. And in reality, we just can't. So it's always best to have that one or two people that you can go to say, hey, I really hate to ask. They already know you hate to ask, but ask for help. You can't do it all, and it's okay to ask for help. Next slide, Maggie. Also, you should consider your social groups. If you're a member of a church, if you're a member of a sorority, do they have a food train, or do they have maybe a ministry in the church that will deliver food or cook food or come and clean your house or run errands for you? Just all these kinds of things. Just think about what it is you do. And if you're like me and you have a calendar, I still have my calendar on paper. I write out what it is I'm doing for the day so that I can look at my week and kind of manage out my time. That is so very helpful when creating a flare plan, because you know what your commitments are during the day inside and outside of your house. You know what meetings you have, what activities you have, even though right now we may not be able to do as much as we used to, but it's still things to keep in mind and things to consider. The other thing that is asked is, should anyone be informed outside of your close circle in case of a flare? Dr. Birnbaum has already said that your first call should be to your rheumatologist to help you determine whether or not it is an emergency and you need to go to the emergency room. But is there anyone else outside of your close circle that you need to inform? Your employer, your children's babysitter, the daycare center. All these things should be taken into consideration. Next slide. So talking about the bills again, as much as we would like them to go away, as much as we would love for them to pay themselves, they just won't. So how are you going to, if you don't already have automatic bill pay, how are you going to pay your bills? If you have a budget, do you have a partner or someone that can pay those bills for you? Do you need to make phone calls to let someone know that your payment is going to be late, that you're in the hospital? These are all just a list of things to consider. There may be things that you need to consider that I have not mentioned, but that doesn't mean that just because I haven't mentioned them, you should not take them into consideration when considering and creating your FLAIR plan. The other thing about a FLAIR plan is just keep asking questions. As it says here, just poke holes in it. Just plug all those holes up. It doesn't have to be very, very detailed, or it can be as detailed as you want it to be. A FLAIR plan is definitely customized to you, your particular situation, your particular circumstances, and the people that are in your circle. Next slide, Maggie. So who are the people that can help you develop a FLAIR plan? I'm going to say first and foremost, your doctor, your rheumatologist. As Dr. Birnbaum has already said, when you are not feeling well and you're not sure whether or not you need to make a trip to the emergency room, call your rheumatologist. Your rheumatologist is the one that should know your health as well as you do, and will be able to tell you whether or not you need to go to the emergency room. You can also ask your rheumatologist, what should I consider in my FLAIR plan? Because your doctor's perspective of your FLAIR plan may be very different than yours. And as Dr. Birnbaum has already said, when you go to the emergency room, the first thing you do is say, I have lupus nephritis, I have discord lupus, whatever it is, and then proceed to say what the symptoms are. There may be other healthcare providers, like if you have lupus nephritis, you might want to involve your nephrologist in developing your lupus FLAIR plan. Also, you can talk to other people that are living with lupus. Compare your FLAIR plans. Does everybody that's living with lupus have a FLAIR plan? Probably not. Some people have heard about a FLAIR plan and others haven't. As Cindy has already referenced, I teach a self-help course. And when we mention FLAIR plan, a lot of times we get the question of exactly what is a FLAIR plan, why is it important, and why do I need it? So, next slide, Maggie. You should develop a FLAIR plan now. We've given you the basis, the reasons why to have a FLAIR plan. You should take the time to develop a FLAIR plan. It isn't just for a possible hospital stay. It could also be used for that time when you're not feeling well and you are confined to the bed and you just aren't able to do the things that you would normally do. That's when your FLAIR plan should be activated and put into place. So it says to create a plan when your FLAIR doesn't require hospitalization, but it's good for people in your circle to have the information so that they know. Also, create the FLAIR plan when you feel yourself experiencing more stress than you normally would. Things are getting out of control. You may feel as if you're in the middle of a tsunami. Sit down and create a FLAIR plan that may help you unwind and de-stress, because maybe using your FLAIR plan, you can begin to hand things off to other people. The question I always ask myself is, yes, this needs to be done, but do I have to be the one to do it? And a lot of times when I really truly sit down to think about it, I'm not the person that has to do it, that has to get it done. Sometimes self-care is much more important than, I don't know, whatever it is. So we have to know that self-care is very, very important. And we know that stress can trigger a lupus flare. So we have to try and manage the stress in our lives, and having a FLAIR plan is a very good way of managing that stress and hopefully minimizing the stress that's involved with the lupus flare. I hope that has been helpful. And Cindy is there to So questions and answers, and I'm hoping you guys have a lot of questions.
All right. Wow, that was terrific. Both Dr. Birnbaum and Cheri, that was a lot of information for everyone to take in. There was a lot of things we need to get done for a flare plan. I trust that everybody's going to run off and do one tonight. Right? Yeah. But I do encourage you to actually, start the process. As Cheri mentioned, when you have a plan, it decreases the stress. So there's going to be enough stress that just if you go into a flare, you're experiencing, an elevated illness at any point in time. So there'll be enough stress with that alone. So let's take one thing off your plate. Let's also hope, what happens if you plan, it doesn't happen. So let's plan for the flare to prevent it from happening. Best laid plans. If you do it, you won't ever need it. So that's what we hope for anyway. You'll also see, Maggie's going to throw a link in the chat to, we have some templates that we created for you, and we've also shared those with your local chapter. So you should be receiving those also from your local chapter if you haven't already, but just some templates to make it really easy for you to create those and develop your flare plan. So that being said, let's get into a couple of questions, Maggie.
Wait, Cindy, before we start questions, I have one thing. So Maggie, I have to apologize to you. I sent you my not completely edited slide deck. And so there was one thing that I wanted to go through with everyone that I think is actually really important, which is to have a script. Okay, and I'll send the slides and maybe you can send them out afterwards.
Of course.
But the script is what you say when you go into the emergency room. And it goes something like, I'm coming because I have chest pain. I am blah, blah years old. I have had lupus for this many years. My lupus features have included kidney disease, heart disease, joint pain, and rashes. And I'm now coming here with 3 days of fever and chest pain, right? And so you want to be able to have that script to say to the doctor. A lot of times when you come in and you start talking, it can get very overwhelming. I know when I'm feeling very anxious about things and I try to talk, I start to cry sometimes. So if you have that script in your head when you first go, that will do a few things. The first thing it's going to do is help you organize your thoughts so that you can communicate better with the people taking care of you. The second thing, whether we want to or not, and I always will talk about bias in the healthcare system, bias against women, racial bias. People are likely to dismiss people with lupus who look okay but feel lousy. And so if you can present your kind of argument, not that this is an argument, but what is going on and convey it in a reasonable way, unfortunately, you are likely to get further along with your communication with physicians, as much as I hate to say that. It's just how things are in our healthcare system today, and it's something that we work on educating people about and being more aware of. So I'll send out the slides about how to have a script and what that script should include.
That's a really great point. Thank you for adding that in. We'll definitely be sharing the slides out when we wrap this up with the recording. So.
Sorry, Maggie. Maggie will tell you, I thought this was last Tuesday. I'm just, the wrong day, wrong month.
So I think that's a great idea. And I think that's really whenever we go in with anything, it's a matter of, knowing, being prepared what we're going to say. And sometimes if you've got to write it down, I say write it down. You don't have to just speak that off the cuff, right? And, draft something and write it down before you go. Sometimes it's a little bit easier when you're a little clearer sitting at home before you go into the hospital or doctor's office or the ER, wherever you're going. Which actually leads us right into our first question. I know you talked about this a little bit, Dr. Birnbaum, but I do think it bears repeating because when should you call the doctor versus just going to the hospital, the emergency room? Is it always your doctor first? Can I just go to the ER? What's really the best practice?
So people learn along the way, when to call and when to not call. But if you're unsure, you call, right? it's never, I hate when people say, I'm sorry to bug you, but that's not the way to lead off. Don't be apologetic. Don't apologize for your disease. You didn't cause it. There's no shame in it. And call sooner rather than later. Call in the morning rather than later in the day, right? Sometimes you're like, well, let me just see what happens over the day. And then you call at 4 o'clock. It's always easier to call at the beginning of the day. If the doctor calls at the end of the day, you can say, you know what, I have this, but I think I'm feeling better. But it's always easier to call at the beginning of the day because my calls pile up and I kind of get to them as the day goes on and then at the end of the day. So call at the beginning of the day rather than the end. Call it the beginning of the week rather than the end of the week. A lot of people will let their symptoms build up during the week and then all of a sudden it's Friday and they're just like, oh no, I've had this kind of brewing chest pain for a few days and now what do I do? And I'm going to have to say, well, I'm going to have to send you to the emergency room because I can no longer call somebody to help out with an EKG or, go to the lab and get this done. So earlier is always better. Okay. Earlier is always better in terms of when to call and try to figure out what's going on. And when in doubt, it's easier to call and you'll learn and, and you'll learn your symptoms. I have patients who have recurrent symptoms and they say, oh, that's just this going on. I know what to do. Don't give yourself, again, my other slides, don't give yourself prednisone on your own. Always clear it with your doctor. We can work out the doses. Patients come in and they're like, well, I was feeling bad. I had some extra prednisone, so I took some. And it's just like, well, how much and for how long? And so, it's always helpful if we come up with a plan together. If you do need prednisone, how much you're going to take and for how long. And the answers usually for me is going to be take this, but call me back in 48 hours and let me know how you're doing, or call me back in however long and let me know. So don't try to manage your own medication.
Very, very valid point. Cheri, as someone living with lupus for quite some time, you've had this challenge, when to call the doctor, when to go to the hospital. You've counseled people on when to go to the hospital and call your doctor. Anything to add based on what Dr. Birnbaum shared?
The only thing that I would add is we have to know our lupus. We have to know our symptoms. We have to know when it's an emergency. So we have to advocate for ourselves. We have to keep track of our symptoms. And when new symptoms develop, we should always call the doctor first. You just don't want to run to the emergency or run to the hospital for every single thing, because you don't want anyone to think you're a hypochondriac. A lot of times doctors hear lupus or, your symptoms and, oh, it's just something related to lupus. Well, it's not as simple as, oh, it's something related to lupus. It may not be related to lupus at all. So I would just say, know your lupus, advocate for yourself, and call your doctor.
Good point.
I'll say one thing. So what Sharika said is you don't want people to think you're a hypochondriac. That's not your problem. That's society's problem if they think you're a hypo. And it's unfortunately something that people start to like, and it's not, as you go along and you learn, are you embarrassed if you go to the emergency room and it turns out nothing's wrong? I know I've done that, and you walk away and you're like, oh gosh, that wasn't such a big, I guess not. But you know what, that's how you learn, and that's how people learn. And if people make you feel bad because of that, again, that's on them, not you. And if you're not, if you're scared, it's there, but it's a balance, and you do get to know your symptoms as but and certainly call. It's patients who go running to the emergency room with a symptom and they wind up having a urinary tract infection that I can easily treat, but their joints were acting up because they had an infection, but so it's always something that's worth a discussion.
Better be safe than sorry, that's for sure.
Yeah.
Without a doubt.
Yeah, and again, no shame in your diagnosis. It's your diagnosis. It is what it is. You didn't cause it. So.
Yep, very true. Yeah. All right, next slide, Maggie. Let's go to the next question we have. Cheri, we've just been talking about going to the hospital. So, and part of your flare plan is to have a go bag. So what's in
Yes.
your go bag? What do you recommend you keep in your go bag?
I think in your go bag, you should have whatever is going to make you comfortable. I have a friend that every time she goes to the hospital, she has Snoopy and the little yellow bird. That is her comfort. You know, that is in her go bag because it's just what gives her peace of mind and comforts her.
Mhm.
So, more practical things to be on your go bag would be a list of your medications. I would have water, specifically now during the pandemic. You're not going to have to be able to have someone coming in and out of the hospital to bring you things. As a matter of fact, you may have to check into the hospital by yourself and they may not let anyone go with you. So you need to be as prepared as you can. So have a bottle of water, have a snack, have something that's going to give you some substance, some nutrients while you're waiting if you should have to wait. Because again, right now, a person may not be able to come in and out of the hospital or the emergency room to bring you anything. You should have your phone and your phone charger. You should make sure that you have your charger. Again, people cannot come and go the way we used to prior to the pandemic. If you have fuzzy house shoes, if you have a t-shirt or robe or something that gives you comfort, if you have a lavender scented eye sachet, whatever it is that's going to provide comfort for you, but at the same time, not hinder the doctors in being able to get to you. So those silky, lovely pajamas that you love to wear every night, you can't do that. You can't do that. You're going to have to wear the hospital gowns, but you can have nice, warm, fuzzy socks. So be sure you have a change of clothes. Be sure you have your medication, your toothbrush, your phone charger, your phone, a good book, anything that's going to help you just relax as best you can and be in the situation that you're in.
Good point.
Do you have anything you want to add to that?
I'm going to reiterate the charger is super important for your phone. And yeah, that's what seems to be getting most people these days is not having the charger around. So
Yeah.
buy an extra one and keep it with you.
That's true. And I would throw in headphones, you know, if you're in the hospital and it's noisy and there's a lot of stuff going on and maybe you just need quiet music or you're listening to a book and, you know, you're too tired to actually read, but you want to listen to something audio. So get a cheap pair of headphones, keep them in your go bag, and that way you don't have to worry about them. And I agree, buy that separate charger, keep that in there. So excellent. And so go ahead, Dr. Berman, go ahead.
Oh, I was going to say, you know, we're living through this pandemic right now and different parts of the country are being affected in different ways. Don't not go to the hospital if you're feeling sick because of the pandemic. Are we going to talk about this later?
You know what, Mike, just go to the next slide. And actually, yeah, there we go.
Ta-da! All right.
It's perfect. So no, yeah, keep going. I think that's a great point.
So what we saw here in the Philadelphia region when we had our surge back in April and May is that our overall hospital census numbers dropped because people were too scared to come to the hospital with their other chronic medical conditions because of their concern for catching COVID. And I will tell you that 9 months into the pandemic, at least in the Philadelphia, New York, tri-state area, East Coast, we feel as doctors, when I walk into the hospital to see a patient, I feel okay. You know, we're masked, we're goggled, we're PPE'd, as is everyone around you. Anyone who has any signs or symptoms concerning for COVID is usually whisked away somewhere separate from where you're going to be. So if you're feeling bad enough to go to the emergency room, don't not go because of the pandemic. We have developed the understanding right now of how to protect ourselves. The rate of transmission of COVID to people in the hospital is actually very low, if anything. We're not seeing doctor to patient transmission. We're not seeing patient to patient transmission. Where people are getting sick and you hear about hospital staff getting sick is often in the break rooms where they're taking off their masks and they're eating and they're talking. And that's where we're seeing most of the acquisition of COVID in the hospital. It's not in direct patient care. Okay, so I don't want you to be scared to come to the hospital if you're feeling really sick because of the pandemic.
And I think that that's a really great point. And we keep hearing now, we're seeing commercials about making sure that you're getting your annual screenings and things like that, because obviously we want to keep that stuff going. We've been in this for quite some time. So there are certain health screenings we need to keep going and stay up on top of our regular everyday preventative kind of health. Yeah. And Cheri, you alluded to several things as far as your flare plan and your go bag changing already with the pandemic. And I think that literally having this plan is actually even more critical during the pandemic, because those people can't come in and out and bring you things. You have to really be prepared to, the kids are at home in school or people are working from home, and how do we manage all of those pieces? So I almost feel like now, not that it's not important all the time, but I feel like there's a little elevated importance of a flare plan now in the state of where we are, with the pandemic.
Absolutely. I absolutely agree. And what you just said is very key, because the children are not in school, and a lot of people living with lupus that have children at home are homeschooling. When you leave your home, if you have to leave your home to go to the doctor or to the emergency room, who is the person that's there with them? Again, considering who is in that bubble with you. Do you need to reevaluate who's in that bubble? Do you need to increase it, or do you need to decrease it? Are you sure that the people that are in your bubble are not coming into contact with other people that could possibly bring something into your home? You don't want to be an alarmist. You don't want to live in fear, but at the same time, you have to be cautious and be very, very careful. So a flare plan is just so very important, not just for the pandemic or not just for a lupus flare, but just in circumstances in life. You never know what's going to happen. And just the security of knowing you have a plan in place and you can call someone and say, okay, I need to activate my plan. Can you help me?
And I'll piggyback on that. And something that Cheri said, people don't like to ask for help. They like to think that they can do things on their own. I think asking other people for help, I've had people teach me this over the years, you're actually giving people a gift. I want you to think about it that way. If you're asking somebody to help you, you're actually giving them the gift of being able to do something good. And now more than ever, people want to feel like they can give something and do something good. And so as hard as that is to take that first step to ask for help, once you do it, you know what you would do in that situation. You would say, of course I will do blank, okay? So I want people to it is a hard thing to do, but people usually wind up being stronger for it. They wind up forging connections that are stronger for it. And so don't be afraid when you're making your plan, saying, if I need help, will you do X? I have always been flattered when I'm someone's emergency contact. You think that of course I'm, yeah. So don't be afraid to do that, to reach out and to say, hey, this is what's going on and I may need this.
I think that's a really great point, especially right now. We are all struggling with what can we do, right? What are we able to do? And this is just a plan. Let's hope that you don't really need it. Exactly. So it's just the opportunity. It's kind of like when you ask somebody to be the guardian of your children, right? It's not that big of a deal, but you're planning, but hopefully you'll never need that. So I think that's a really good point, is that I know when anybody asks me to do something, you don't want to go ask them, but when you do get asked, it's a bit of an honor, and it feels good to be able to help other people. So again, help other people by helping yourself and really creating that support system. So I think that's an incredible point. We've been talking a lot about flares and hospitalizations and working from home, and all of this leads to the potential of, what if I'm not able to work? What if I have a long-term flare and I either have to take some kind of disability, some kind of, whether it's FMLA, how do we make that decision? Is that the doctor? Am I making that on my own? Help me guide that. Dr. Birnbaum, let's start from your perspective. How do we start with making that decision?
So when I'm meeting a new patient and they are working, and they're working for a company that has more than 50 people here in Pennsylvania, and they've been working there for long enough to qualify for FMLA. I will always fill out their FMLA paperwork, whether they're coming in to see me with some mild joint pains and rash, or whether there's something more severe going on. The FMLA paperwork allows for you to take time off to go to the doctor without getting penalized. It allows you to take time off if you're having a flare. And so you can either, when I'm filling out FMLA paperwork, it's either a continuous FMLA for a certain duration of time continuously, but it also allows me to fill out something that says that you may need doctor's appointments several times a year. You may have flares however many times out of a year, and you may need however many days out of every 3 months to kind of recuperate. And so that allows you that permission to go to the doctor, to feel ill and call in and be protected. So I usually try to, again, be proactive about FMLA. If you're eligible for FMLA, the paperwork gets filled out. When you're considering disability, again, that's usually with more severe manifestations, and that's a conversation when you're feeling like you're struggling, like you're not able to work, and whether it's from the lupus or being overwhelmed by it. Okay, right? So whether it's the lupus or the kind of what we call now not the actual just physical organ manifestations, but all that is secondary that comes with having the chronic disease and trying to manage work, family, medications, bills. Sometimes that qualifies you for disability too. So it's a conversation with your doctor too.
Yeah, and just for clarification for anybody who's not familiar, FMLA is Family Medical Leave.
Oh yeah, thank you.
I should have said that too in the beginning. As Dr. Birnbaum referenced, it is not every employer is required to offer it. If you work for a smaller company, there are certain minimums of number of employees where they are required to offer it. So you'll want to check with your employer, check out your employee handbook, and you also have to be there a certain amount of time to technically qualify for it. So those are some things that you're going to need to know on your end before you even address that or bring paperwork to your doctor. But I think that's a great approach, is knowing that there are different levels of FMLA. It's not like you're going to go take 3 months off the entire time. There are things that you may need along the way. And Cheri, I know you've talked with and you've been through this personally and have talked with so many people and counseled them through it. From a disability and Social Security disability insurance and things like that, that process can be pretty daunting. Any words of advice for going through that or starting that process, or when you might want to consider that from a lupus warrior perspective?
Definitely talk to your doctor and work with your doctor, because your doctor is very key and very instrumental in the process, because the first thing they're going to do is ask for your medical records. They're going to want to know your medical history, and you're going to have to request all of that information. Definitely start with FMLA and the intermediate leave. Then you can take short-term disability, and if it progresses into long-term disability, depending upon whether or not your employer provides long-term disability, you would have to exhaust all of that if you are trying to get Social Security disability. So you would have to take your leave from work and then apply through the process. It is not an easy process. It is time consuming. There have been cases where people have applied for Social Security disability and have gotten it in as little as 6 months. Sometimes it takes much longer than that. And more often than not, the person is not approved the first time they apply for it. Sometimes they have to even go to a lawyer, disability attorney, to get through the process. So your doctor is very key, very instrumental. But the other thing is, when you are considering Social Security disability, really truly talk to your doctor about your job. Because if your job is stressful and you're finding that you're not able to do your job and it's creating more stress on you, which is creating more of a problem with your lupus flares, and you're going to the doctor more often, talk to your doctor and let your doctor know what it is you do. Because when I went through the process, I had to provide job description of what my job was. And my doctor had to, quote unquote, for the most part, I'll say, certify that it was my job that was causing the problems that I'm not causing the problems, forgive me, that it was exacerbating the problems that I was experiencing as a result of the job that I was in. And then I had to consider, is there another job that I could do that was less stressful, that may not exacerbate the lupus as much? And because of my career field, there wasn't anything that I could do that was less stressful, that I was going to be able to maintain a quality of life. So it was just going through the process, talk to your doctor. If you have to get an attorney, go to an attorney that specializes in Social Security disability to walk through the process with you. But just know that it's going, more often than not, it's going to take time. It is not a short process.
It's not a short process, and the psychological toll of just applying for
Yes.
disability
Yes.
and getting all that paperwork and getting
Yes.
it back in the mail and looking at it, and the everything that goes along with being disabled is just magnified by applying for this process. It's truly painful. And know that the paperwork that they send us for SSI disability doesn't often speak to why a lupus patient would be disabled. It's a lot of mechanical, how many pounds can they lift and how long can they sit and how long can they stand? And it doesn't speak to the cognitive problems that come along with being sick and other things. And so very often I look at that stuff and I scream in my head, and then I write, you have to write a separate letter because the application itself sometimes is not geared towards lupus disability.
And I'll do a little commercial for our previous program that we did. We have, if you're familiar with the Ask the Experts program that we do, the monthly series, you can go back to it. I just looked it up. It was April 2019. We had a really good detailed program on SSDI and getting through the process. So feel free to check that out. You can check out the recording and the slides. And again, just go to any of your local chapters on the Ask the Experts section. April 2019, and you can hear a program on that. So another question that's come up so frequently is, and because we haven't been able to go anywhere or do anything for the last 7 months, but of course we're all itching to go away and do something, is can we go on vacation? Like, what do we do about going on vacation? Not only just in a pandemic, but generally, I'm living with lupus. I have the potential, potentially in a flare in the sun, whatever I'm doing. How do I manage that? Cheri, let me start with you on this one. You go on vacation. How do you manage things while you're on vacation?
Well, I'm a little bit, I'll say a little bit manic about vacation. I go to the same place all the time. And before I went on vacation, I found the nearest hospital. I talked to my rheumatologist about the rheumatologist there. So just again, part of my plan, my own personal plan, is just to be safe and to make sure I'm not driving myself crazy with, oh my goodness, I don't feel well, what do I need to do? I mean, I've gotten beyond that now, living with lupus so long. But yes, you could go on vacation. Go on vacation, have a wonderful time, but make plans and provisions, take your medication with you. For me personally, I know I go to my happy place every year. I have one happy place, it's Myrtle Beach, Grand Strand. I know where the hospital is. I know the rheumatologist that I can call. And I'm just so very grateful I've never had to go to the hospital or call that rheumatologist. But just like anything else in life, you just have to plan it. If you're photosensitive, you know that you should not be laying down on the beach. Just, protect yourself. Sunscreen, take those everyday precautions that you would normally take. But in the meantime, try and relax. Try and enjoy yourself, and don't overthink it.
Dr. Birnbaum, anything to add from the physician's point of view?
Yeah, I love hearing when my patients are going on vacation. It means they're feeling well enough to even plan it. So that's always great. Again, sun protection is super important. So we'll talk about how to plan out your day on vacation so you still feel like you're on vacation, but you still get to be outside and enjoy wherever you are. And then I always have patients take extra medication with them in case something does come up. Do you have extra prednisone if you're susceptible to infections? Do you have, antibiotic with you so that, you're not running around somewhere where you're unfamiliar trying to get, trying to figure out what's going on. And there's hospitals everywhere, but if we can avoid that, with a phone call, that's again, and packing extra medication.
Yeah.
Yeah.
Very, very good point. And at least knowing where it's sometimes these days, it's when you're using a chain pharmacy, a CVS, a Rite Aid, a Walgreens, the access of having that, be able to get a refill or another prescription somewhere locally, wherever you might be, if you're still in the States. I mean, obviously if you're traveling to different places, but there's some comfort level there, knowing that we have plenty of access there too.
Yeah.
And I'm just seeing some recurring questions. I'm seeing this recurring theme of still struggling to understand, when, especially when you're newly diagnosed with lupus. And Dr. Birnbaum, I'll throw this over to you. Is how do I really know if it's lupus? How do I know if I go in really feeling my gut tells me it's my lupus, and I've got something else going on, and I go in and they send me home because it's not my lupus? And the frustrations of all of that, you've seen it a million times, and I know sure you've experienced it too. So what advice do you have? I'm kind of summarizing some questions because I'm seeing a recurring theme here. What advice can you give to our listeners tonight, and encouraging them to, I know, be your own advocate is such a huge aspect of it.
Yeah. Again, so that touches on what I had said earlier. When you're in the ER, if you haven't spoken to your rheumatologist, that's when you want them to talk to your rheumatologist before you leave, right? Because a lot of times you come back and it's like, no, wait, that was your lupus, or wait, they didn't look for this. Or I've had patients go home with infections that were given steroids because they said, oh, the patient has lupus, here's steroids, but something else was going on. So in the ER would be a good time to start saying, can you also touch base with my rheumatologist? So that's one thing. And then follow up, right? So if you get sent home because you're not sick enough to be in the hospital, and these days it takes if you're in the hospital, you're sick. If you're not feeling well, you went to the ER, they sent you home, you need to follow up with your doctor and try to piece together what's going on. Again, trying to live with that uncertainty is really uncomfortable. The more you talk about it with your physician, the more you live with the disease, the more you reach out to other people and have support and understand it, the more comfortable you'll be. So, I have a patient now who I spoke to on Friday, and I said, how are you doing? She's like, I'm getting my, my chest pain and my palpitations. And, a few months ago, that was like her in the emergency room. And now it's like, this is starting up again. I think, what should we do now? So it's becoming more comfortable with some of these symptoms too.
And I think, Cheri, you even said that earlier too. You said just understanding what is lupus, but that takes time, right? That takes time to understand what is a flare for you, especially if you're newly diagnosed. And it's an ever-changing disease. It changes how you're being affected over time. So if it's a new symptom, don't just discount it, but you will learn eventually what are the common things, how you react from a lupus flare, or even just an elevated lupus. If you're not considered fully in a flare, what might be related to your lupus. So I think that just takes time. So trust in your gut. I say advocate. I continue to remind everybody, no matter what you have, we have to be our own advocates. Whether you have lupus or you don't have lupus, being your own health advocate is so critically important to being successful within your conversations with your physician, the emergency room, wherever you are having those conversations. And I do see a question up here, which I think is worth addressing, Dr. Birnbaum. Do you recommend that when if you are going to the emergency room and you've talked with your rheumatologist, to ask them to call the ER in advance for you? Does that help?
I usually will. I will usually call the emergency room, and I will always ask to talk to the triage nurse or the attending physician, and I will say to them, this patient's coming in, this is what we're worried about, this is what I need done, And while they're there, would you mind drawing off, a double-stranded DNA, a complement level, those things that I need that they may not, that's not their standard workup, to help me figure out if this is a flare, if it's an infection, what's going on. This is what I'm going to need from you. And I'll say, call me back when you're done, or, call the fellow on call if you're on a university hospital, to try to figure out what's going on. So yeah, if I talk with the patient and they're going to the emergency room, I will reach out to the emergency room usually.
Great. So for those of you listening, encourage and ask your doctor if they will do that, or just be mindful of knowing that if you know that they do that, it's always good to alert when you get into the ER to say, hey, I think my doc's called in advance. And so it's good I think it's good for the ER team to know that you're in the know as well. That's helpful. And I'm also go ahead.
I'm sorry, Cindy, can I go back for just a second?
Of
when
course.
Dr. Birnbaum was talking about newly diagnosed, or those people that may not know it's specifically lupus or not, the other thing that I found so important, and what we talk about in the self-help course, is tracking your symptoms.
Yeah.
It is so very important to track your symptoms, specifically if you're newly diagnosed or you're in that phase of the doctor isn't quite sure, because we know that lupus sometimes, it manifests itself in so many different ways, and you just never know. So if you're tracking your symptoms and keeping track of how you feel, if you feel crappy one day, the next day you have a lot of energy, or, you go out in the sun and you feel drained, whatever your symptoms are, it's so very important to keep track of them. Journal it, write it down, use a calendar in your phone to say, today I felt like crap, my joints are swollen, I have Raynaud's, I drained the blood, whatever it is, because when you go to see your doctor, you will be able to tell your doctor or show your doctor, this is what I've experienced over the last 3 weeks or last month or last 6 weeks or whatever the case may be. And that's going to help your doctor figure out what's going on with you as well. And if, we can use your phone, but there are apps out there that those of us living with lupus can use to keep track of our symptoms that will help us. Because if you also live with brain fog, you're not going to remember that you had 3 crappy days in a row 6 weeks ago, or whatever the case may be. You're not just going to remember that, especially if you go into your rheumatologist's office and you're feeling really good that day. We don't want to think about the days we felt bad. We want to remember the days that we felt good. So keeping track of our symptoms is very, very important.
It's also important, again, Cheri, if for documentation, if you come in and you're looking good and the doctor writes, patient's looking good, right? As opposed to if you can say, I felt crappy, this many days, and the doctor writes, patient having 3 out of 4 weeks of feeling bad, that's going to make a difference down the road if we're looking at disability one day and they're reviewing your record. So again, very important to keep track of.
Well, and we know that whenever we're not feeling bad, we're not feeling well, we're having a crappy day, she said. And it's kind of like when you go to the hairdresser, you finally schedule a hair appointment because you're having bad hair days. And the day you go to the hairdresser, you're feeling great, right? The day you finally get into the doctor's, because you're making your appointments probably pretty far out, you may be feeling pretty good. So I think that the journaling is a fantastic idea. And Dr. Birnbaum, I'm going to come to you with one more question, then I think we're going to wrap up because we are 10 minutes over. But again, if anybody had to leave, we are recording. But there's a couple of questions that are talking about kidney involvement with lupus. Obviously, we call that lupus nephritis. And, when to get from a urologist to a nephrologist. And maybe you could just address that generally, lupus and lupus nephritis, and how to kind of handle that aspect.
Did you say a urologist?
Somebody has mentioned going from a urologist to a nephrologist, and yes.
Okay, so urologists usually aren't involved because we're usually dealing with the smallest part of the kidney itself, and so not necessarily the plumbing involved, which is more of how I think about a urologist. The nephrologist actually thinks about the filtering mechanisms. But when we're seeing symptoms of urine with protein in it, urine with blood in it, swelling in the legs, a low protein level, and high blood pressure. And then in the blood work, again, a low protein level and an elevated, what's called a creatinine, kidney function. Those are signs that there's kidney involvement. The creatinine is kind of the last thing to go up. So that kidney you can have a normal kidney function on your blood work and still be having kidney problems. There's other things that we measure as rheumatologists, which are your complement levels, your C3 or your C4 are what they're called, and your double-stranded DNA levels. And so if we're seeing changes in any of those blood parameters or urine parameters when we're looking at the protein and the blood, then and we're looking at your blood pressure as well, then it's time to think about seeing a kidney doctor or thinking about obtaining a kidney biopsy. The way medicine's evolved is it used to be that the kidney doctors were the ones who did the kidney biopsies. In many places, that's still how it's done. And in some places now, it's an interventional radiologist who will actually do the kidney biopsy. Does that help?
Yes, there seemed to be a lot of questions about lupus nephritis and involving the kidney and who to see. So I think that's a great, that's a great story.
So your rheumatologist usually drives that and helps figure things out. There are parts of the country where rheumatologists are not as widely available, and the kidney doctors are the ones managing the lupus. So if anyone's out there and that's what's going on, then that's also not inappropriate if the rheumatologist is harder to get to.
All right, fantastic. I think that just about wraps us up. We've got few more tips. Dr. Birnbaum, we're going to shoot this over to you.
Oh, that's where my last slide went.
Yeah.
All right. Well, so we're no longer just Pennsylvania, but everyone go vote. If you're gonna, however you can, go vote, be safe about it. If you're gonna go stand online, bring a chair. If you're gonna go vote and you think you're going first thing in the morning, do not say I'm running out to vote, I'll be right back to take my medication. You may be there a while. Take your morning medications, take a snack, and then go vote. Don't not take your medicine to go run out the door. Wear your mask, continue social distancing, and get your flu shot. Everyone talk to your rheumatologist about any other vaccines that you may need to help protect you for other infections, be it Gardasil, your shingles vaccine, your pneumococcal vaccine, okay?
Awesome, fantastic. Well, I want to do a huge thank you to Cheri, Dr. Birnbaum, for your insight, incredible amount of very helpful information. We've kind of gone a vast variety of information here, especially through the Q&A. So super helpful. I hope you all enjoyed it. Dr. Birnbaum's information is there. Cheri's information is there. Please feel free to email your local chapter if you have additional questions. I will do a little program commercial. We are having at the Philadelphia Tri-State Chapter a Living Well with Lupus seminar on November 14th. You can find information on our website about that, and Maggie will probably put something in the chat. And so I just want to remind you all to please take a moment and complete following this program. You're going to be taken to a program evaluation that really helps us with future programming and how we did today and what you find most helpful about our program. So thank you very much in advance for completing that, and watch for an email from your local chapter with the recording as well as the slides. And that wraps us up for the night. Again, deepest thank you, Cheri, Dr. Birnbaum. Stay safe, stay well, and thank you for being here with us tonight.
Thanks for having me.
Bye-bye.
Cheri, good to see you. Be well.
Be well, everyone.
Take care, Dr. Birnbaum.
All right. Bye.